Okay. Oh, that's good. We're going to set you right up there. There we go. Well, hello, George. How are we doing today, big guy? Pretty good? Can we look at those pretty teeth? Oh, my gosh. So let's take a look here, okay? Let's see here. We'll get our light fixed so we can see, okay? Looky there. What a nice set. Let's tilt forward just a little bit so everybody can see real well. And I'll hold that if you'll put your hand right down there for me. That's great. Let's take a peek here. Oh, looky there. Okay. Okay. Yeah, that's quite a set of teeth you got there. Yeah, looky there. Okay, let me get my little tooth wiggler there, okay? Okay, let's look again. Oh, yeah, there we go. Let me look over here, too. Let's check up here. Okay.
And it's too hard.
Oh, that's quite a set of teeth you got, you know?
And they can't come out too hard.
Oh, I see. Well, let's take one last look, okay? One bite together for me, all the way together. There you go. That's great. Okay. 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 All right, looks just fine. On this, development is normal. Anterior teeth will be replaced. Primary teeth primary. Okay. Hey, I really appreciate it, big guy. You did a good job for me. Some crowding of the lower anteriors.
Hey, look at the numbers. Hey, counting numbers.
Noted.
Counting numbers.
Numbers? Oh, there's a lot of numbers up here. There's your numbers up there. 1937 to 1986.
Football numbers.
Oh, I see. And there's no decay or problems of that sort. And everything looks fine. Appreciate it, big guy. You're all done. I've got something for you, though. Here's a special toothbrush for you. And we'll take a look, okay? Let's see what we got in here. Oh, looky here. You got a green toothbrush. That's all yours. And what you want to do, every night before you go to bed, there's some toothpaste in there, too. Every time before you go to bed, now I want you to brush your teeth real well for me, okay? Alrighty? Once you put that back in there, you can put that down in your cubby, okay?
George, bring it to me.
Bye-bye, George. Who's next? Evan. Have a seat there for me. Well, let me see. We got a whole bunch of teeth here, don't we? Let's take a look at these teeth, okay? Open real wide and look at the camera there. Look at the camera. There you go. Oh, looky there. What a set of pretty teeth you got. Let's take a real good look. Would you like to hold my mirror for me? There you go. That's neat, isn't it? Can we take another look at those teeth? Let's do. Get our light so we can see. There we go. Wow. Let's look here. Oh, yeah, looky there. Uh-huh. Uh-huh. Yeah. Uh-huh. Let's look at the front ones, too. Uh-huh. Yeah. I got my little tooth wiggler here we'll use here in just a minute. There we go. Let's see. Mike, you can get closer shots. Just take...
Just waiting to see what you got to say.
Yeah. See the audio, we can use at different portions. There's no problem with that. I would say go for whatever you want to go for.
Okay, so you just leave it up to me.
We can stop. You know, I can see while you're zooming in. I can still continue with this speech, and I can edit it at different points. So it doesn't matter. Oh, let's see, Evan. Let's take another look at those pretty teeth. Oh, looky there. They're so nice. Want to tilt back just a little bit for me? That's good. There you go. Oh, those are nice teeth. I like those teeth. Okay, let's look at the ones up here. Uh-huh. Okay, you want to bite together for me? Here you go. All the way on the back teeth. Okay, there you go. Let's take a look at those teeth. Now bite together like this. Okay, grind back and forth on those teeth like you're chewing. There you go. Uh-huh. Okay. Okay. Okay, on this, development, put a hyphen or the, possible developing class 3 occlusion. Class 3. Possible orthodontic consideration at a later date. And otherwise, everything looks just fine. That mouth looks real good. By the possible class 3, also in parentheses, just put edge-on occlusion of molars. Evan, you did a real good job for me, big guy. How would you like to have something? I've got a special toothbrush just for you. Let me get it for you. Here we go. Let's take a look and see what's in here. Let's look in here. Look here. Looky here. You got a yellow toothbrush. That's pretty neat. I wonder what else is in there. I bet there's some toothpaste in there. Let's look. There's some toothpaste. Now I'll tell you what I want you to do. When you go home tonight, I want you to brush your teeth real well before you go to bed, okay? You promise me?
Yeah.
All right. That's great. There you go. Put your toothbrush back in there. Very good. Thank you.
Do your paper sticker. Michael.
I might make one little suggestion.
Yes.
Is if we stop this and play back the last minute or so, just to make sure.
When we get them up.
Okay.
That'd be a good shot.
Good.
For that.
Okay. Now let's see. Okay, this is Michael.
Right.
Hi, Michael. How you doing? Pretty good. Can I see those pretty teeth? Looky there. I like those teeth. Let's take a look here. Just a minute. Okay, open real wide for us. Oh, looky there. That's a nice set of teeth you got. Okay, I've got a special mirror here that we use to take a look at teeth so we can see all around in the mouth, okay? And we're going to use this in just a moment. Want to chin up just a little for me? That's good. Oh, looky there. What a nice set of teeth. Let me look over here too. Uh-huh. Okay, open real wide. Hey, all right. Real wide. Hey, that's great. That's good. Let me get my little wiggler out here. All right. Oh, my word. Looky here. Good set of teeth. Those teeth look real fine. Open a little wider. Okay. Have you been to the dentist before, Michael? You have? Hey, that's neat. Did you have any problems, any cavities, anything I need to know about? Nope. How old are you? 4 years old. My gosh, you're a big guy, aren't you? Well, I'll tell you what, those teeth look real fine, and I have something for you to take home. Guess what's in here? Let's take a look and see, okay? Oh, you got a red toothbrush. Look at there. You got a pretty red one. Pretty neat, huh? Tell you what I want you to do. When you go home, I want you to brush your teeth real well every night, okay? Especially after dinner and before you go to bed. And you'll keep those teeth in real good shape. You bet. We'll put this right back in here for you, okay, big guy? There you go. Bye-bye, Michael. Development normal. No problems. Everything's okay. Well, hello there. Who do we have here? Let me see here.
Jared.
Jared. Okay. What do you say, Jared? How you doing today? Good, good. Can I see those pretty teeth? Oh my gosh, those are pretty neat. We're going to take a real good close look at them here in just a minute. There you go. You want to sit back here for me? There you go. Well, let's take a peek here. Want to lean back just a little for me? There you go. Good, good boy. Okay, bite together for me, all the way together. There you go. I see you're getting some new teeth up there in those front ones. Uh-huh. Okay. Okay. Bite together. Let me look over here. There we go. Uh-huh. Okay, teeth all the way together now. Just like that. There you go. Good fella. All right. Okay, we'll want to take another look around just a moment. Open real wide now. There you go.
Sarah, back.
Hey, that's pretty good. Looks fine. Let me look up here now. Open real wide. Open real wide for me. There you go. Open real wide until all the way back. There you go. Let's check over here too. Okay, bite again together. Bite again. Bite. There you go. Okay, again, bite one more time. There you go. Okay. Everything appears normal. A possible overbite of the front teeth, but I would consider that minimal. Hey, you did a real good job for me. I have something for you, okay? Hold on, I'll get it. Let's take a look inside here and see what we've got. Ooh, I wonder what's in there. Let's see. Oh, you got a green toothbrush. And that's a neat one. It's got an alligator on it. See the alligator on the handle? That's pretty neat. What do you think about all that? Pretty neat, huh? All right. And there's some toothpaste in there. See, it's all in there. That's all your stuff right there. And now, you know what we're going to do when we go home tonight? We're going to brush our teeth real well, especially after dinner. Okay? How's that sound, big guy? Okay. Why don't you put it right back in there for me? You want to give us a big smile? Give us a big smile. Here, I'll put it back for you. There you go. There we go. Bye-bye.
I want to make a suggestion. If you can move
Yes.
in a little bit closer. Yeah.
Okay. Let me see this just a moment. Now, let's see. You're Michael, right? Your name is Michael. Okay. How you doing, Michael? Pretty good? Good, good. Can I take a look at those pretty teeth? All right. Why don't you lean all the way back? There you go, big fella. Let me take a look in there. Oh, yeah. What a nice set of teeth we got here. Okay. We need to take a real good look at them. Go ahead and lean back for me. There you go. Okay, one bite together for me. Bring those teeth together. There you go. Just like that. Go ahead and bite together for me. Go ahead. One bite. Okay, well, we'll do that later because I see something else we need to look at. Open real wide now. Open real wide. There you go. Oh, you're doing so good for me? Okay, let's look up here. Okay. Can you bite together like this? You can't. I bet you can. Just like you're chewing your food. When you're chewing food, I bet you can do that for me. Why don't you go ahead and put those teeth together just like that, and I'll look at them. Okay. Okay. All right. Okay. No decay noted. Okay.
Did you see that? Three. Nice.
Okay. On Michael, though I don't see them clinically. So they might be seen on the X-ray, but clinically, unless. Let me take one more look. Open real wide. I appreciate looking at that. Okay. All I would say, there is a little dark place here, but like I say, let's see, to word that properly, from a clinical standpoint, the cavities appear to be minimal. Without X-rays, it would be difficult to determine, the extent of decay between the teeth, if there is. What I did note of more importance is that the upper left lateral incisor and upper left canine.
Upper left.
Lateral incisor and the upper left canine are in crossbite.
Lateral what?
Incisor.
Okay. And canine.
Are in crossbite. And will require interceptive means of repositioning. Well, Michael, everything looks basically pretty good. There are a couple of cavities in there, but nothing to be really concerned about, I think, at this point, other than maybe something that they might have seen on the X-ray. I understand you've got a dental appointment coming up pretty soon, don't you? You have a dental appointment coming up in a couple of weeks? All right. Well, they'll be sure and get in there and take care of that for you. And I've got a present for you. Here's a toothbrush and some toothpaste. Let's take a look and see, okay? Let's see what color one you got. An orange one. You got an orange one. See Alley Croc? He's an alligator, see? I'll tell you what. I'm going to put this back in there, and you can take this with you. And tonight, before you go to bed, I want you to brush your teeth well for me, okay? All right, there you go, big fella. Bye-bye.
I might suggest, in there, crank it on, keep the door halfway shut. It might be better to keep the kids back there so they don't get too hot.
Yeah.
We just gotta check the home.
Do we have a lot more?
There's 8, including her.
That's all that's left?
That's all.
Okay. Okay.
This is. I think they have been to see the dentist.
Okay. Now this is sister. Okay, let's examine. Let me see just a moment.
It picks up that air conditioner.
Oh, that's so. We only have 8 more. We don't need that on. We'll manage.
You don't want it on?
No. Okay, there we go. Let's see, your name is Desiree, is that right? Is that how they pronounce that? That's a pretty name. I like that. Could I see those pretty teeth just a moment? Oh, looky there. That's a nice set of teeth. Now, I'll tell you what, we want to take a real close look at them. Now, let me take a look here. Oh, those are nice teeth. Pretty teeth. Let's look up here too. Those are nice teeth. Those are real nice teeth. Okay, let me get my little wiggler out here just a moment so we can look at them just a little closer. You want to bite together for me? Go ahead and bring those teeth together. Bite. There you go. Okay. Let me look over here. Okay. Desiree, we have no cavities. We do have a developing overbite, anterior overbite. But at this point in time, I wouldn't be too concerned. She's still pretty young, and there'll be plenty of time in the future to consider that.
Okay.
I have something for you, Desiree. Let me get it. I have a special toothbrush that you can have. And let's open it up and take a look, okay? Let's see what's in here. Oh, looky here. You got a green-handled one. Looky there. And look who's on there. Look at that alligator. See all those teeth? That's pretty neat, huh? Tell you what. I'm going to put this back in here for you, and you can take it home. And tonight, after you have dinner, I want you to brush your teeth real well for me, okay? You promise? Good girl. There you go. Thank you. Well, hello there. Why don't you have a seat up there for me, okay? My word. Can I have these? Thank you. Well, let's see. Your name is Gina, right? Hi, Gina. Can I see those pretty teeth? Let me take a look at those pretty teeth. Let me get my mirror here. You want to hold on to this just a second for me? It's neat. This is how we see pretty teeth. Let me see those pretty teeth. I bet you got a nice set of teeth in there for me to look at. Can I take a look? Open real wide. Gina, look at me. Gina. Look at me. Can we take a look at those pretty teeth? I see them in there. They're in there. Come on, let's take a little peek. Ooh, there we go. Can we put our hand right down here? There we go. Why don't you hold on to my mirror for me?
Hold this for me.
There you go.
Hold the pen.
There you go. Good girl. Can I take a little look here? Open real wide. Oh, looky there. I see teeth in there. Yeah. There's a whole mouthful of teeth in there. Can you open real wide for me, honey? Gina? Open real wide for me. Take a look here. Look at me. Can we take a look at those pretty teeth? Yeah, let's look at those pretty teeth, okay? Let me come around here. Okay, chin up just a little bit, hon. There you go. There you go. Open real wide. Open real wide for me. Real wide. Aw, can't I see those pretty teeth? Can I see those pretty teeth? Oh, won't you let me? I'll tell you what. Why don't you sit over there, and we're going to let someone else come in. We'll look at their teeth too, and you can watch us do that, okay? Does that sound like a pretty good idea?
You want to wait?
Now, why don't you wait, and we'll come back in just a minute. Can we have our pen? I'm going to take our pen and just give it back to Jolene. There we go. Gina, you can sit. Why don't you sit down there, honey, and watch for us? Well, hello there. Why don't you have a seat there for me, big guy? Well, let's see here. And you're Benjamin, right? Did you know I got a little boy by the name of Ben? I bet you know my Ben, don't you? Ben Hensley. Yeah, we know you. Ben, can I take a look in your teeth there for just a minute, big guy? Okay, why don't you lean back right here for me, and let me just take a quick peek. Oh, look at those teeth. Now that's what I call a good set of teeth. And you've got a filling back there, don't you? You've been to the dentist before, haven't you? Hey, that's okay. Let's see. Let me get my mirror here. And we'll take a real good look at those pretty teeth. Want to lean back just a little for me? There we go. That's great. Okay. That's a nice set of teeth. Let me look up here too. Oh, yeah, that's quite a filling, isn't it? Let me look here. Okay. Okay, you want to bite together for me? All the way together. Oh, yeah, there we go. Okay, all the way in the back teeth. Let them slide back. There you go. Good boy. I'd say everything is normal and as it should be. No problems. Yeah, I appreciate that. You're a good boy. I've got something for you. I've got a special toothbrush that you can take with you and take home. And here it is. Let's get it out and take a look at it, okay? Oh, looky here. You got a red one. Hey, that's pretty neat, huh? Now, I'll tell you what I want you to do tonight after dinner, and especially before you go to bed. I want you to be sure and brush your teeth for me, okay? Make sure you get the front ones, the back ones, get all around in that mouth real well for us, okay? All right, good boy. And we'll set it right back in here, and you can take it down to your cubby. All right, thanks, Ben. Bye-bye.
Bye.
Who's next?
Now, when you're bending over there.
Does it get into the picture?
Yeah.
Okay, then I'll keep on this side, then. I'll stay to this side.
Basically, you want a 3-shot, 2-shot.
Sure, I'll take them.
3-shot.
Oh, hi there. Oh, gosh. And your name is Brea? Brea, excuse me. Okay, Brea. Brea, have you been to a dentist before? Oh, this is your first time to see a dentist? Oh, okay. Here's your papers. Can I take a look at those pretty teeth? Oh, my word. Looky here. Oh, let's see. Yeah, Yeah, there we go. Let me get a mirror here so we can see real well, okay? Okay. Might tilt forward just a little for me. That's great. Let's looky here. Let's look up here. Okay. Brea, you want to bite together for me? There you go. All the way on the back teeth now. Okay, is that where you normally bite? Okay, you want to try it again? As far back as you can. Go ahead and just bite together. Okay. Okay, let me take a real good look because this is real important. Now let me kind of hold on to the jaw here. I'm going to put my hand back here to make this easy. Okay, now bite together right there. Okay. All right. Okay, look right at the camera. There you go. Okay, we have a class 3 occlusion here, edge on, and will probably require orthodontic consideration at some time in the future. In addition to that, her lower right first primary molar. Has a little area of decay. Let me look at just one more time there. Bite together, all the way together. Yeah. And we may have to have braces sometime in the future for you, because you know how your front teeth come together. So I wouldn't worry about that too much. That's something that we can think about later. I have something for you. I have a special toothbrush. Let's see here. Let's open it up and take a look. Oh, you got a green one. There you go. Tell you what. There you go. What I want you to do tonight and every night before you go to bed is I want you to brush your teeth real well and make sure that you get all around all the surfaces and everything real well for me, okay? Ray, everything looks fine, and we'll send that home to you. And as far as that little area of decay, we'll let your mom know about that, okay? All right, thanks. Bye-bye. Well, look who's here. It's Rachel. Want to have a seat here for me, big girl? Oh, my gosh. Rachel, can we see those pretty teeth? Want to open real wide for me and let me take a look? Oh, my gosh. Okay. Since she's mine, we won't write on this one because I already know. Well, I'm afraid you might have to have braces sometime, girl. I don't know what we're going to do with you. Want to bite together for me? Okay. Rachel's probably going to have braces. She has developing class 2 occlusion with slide over bite. But we'll worry about that when the time comes, won't we, Rachel? And since you're my little girl, when we go home, I'll give you your toothbrush at home, okay? What do you want to say? What do you say? Okay. I'll see you. Bye-bye.
Instruments and sterilize.
Yeah. Let's go ahead and just run them through. Because they've all been used. Do you want to come back up here and let me take a look for just a minute? Just for a little second. There you go, big girl. Oh, Gina, would you hold on to this for me? Now that's a very special little mirror that we see little teeth with, so we can make sure that they're okay and they're all there. Could I take a look in that pretty mouth? You can let me take a look? Oh, the other little boys and girls let me take a look. It was pretty neat. Could I look again just for a minute? You sure? Just take a minute. Let me borrow this just for a second. Can you see your face in there? Can you see your face in there? I bet it's in there. I bet it's in there. Let me take a real quick peek. Come on, let me take a little peek. Can I take a peek? Oh, you sure? I'd sure like to see those pretty teeth. I bet they're real nice. You want to come back a little bit later and let me do it? Okay, why don't you go sit over there and we'll come back in just a minute and look, okay?
You want to take a break here for a second and kind of go over the battle plan?
Yeah, I put it in stop and we can put that fan back on, the big fan, for just a minute.
Bunch of empty chairs.
Oh, yeah, great. Well, Ben, are you going to be good? We don't do that. There we go. Let's put our feet down. That's a ticket. What do you say, Ben? Can I take a look at those pretty teeth? All right. Let me get a mirror here so we can see, just like we do at the office, and we'll get our light out here too so we can see too. There we go. All right. Want to open real wide and let me take a look? Oh my gosh, look at all those teeth in there. Okay. Now let me take a look here. Open real wide. Ooh, get that old tongue under control there. Okay. Let me get my little wiggler in there so we can look for cavities. I don't think we have any, but we better check and make sure, okay? Turn this way just a little bit, Ben. There you go, big guy. Real wide there, fella. There we go. I'm going to turn this way a little bit. Now let me check the upper ones. Turn over this way a little. There you go. Now lean back. There we go. Open real wide. Well, Ben, it looks pretty good, I think. Let me see here, one last thing. Okay, bite together for me. Keep them together. There you go. Okay. Well, as with Rachel and Ben, we're looking at class 2 occlusion. And Ben, when you get home, I'll bring your toothbrush to you, okay? What do you say, big guy? One right now? Can I give it to you when we get home? No, I can't. Okay, just like, I know. Just like the other guys. Okay, we'll get your toothbrush out. It's just like the one you got at home, except for I bet this one's a different color. Let's see. Oh, Ben got a red one. That's pretty neat, isn't it?
Same as Rachel.
Uh-huh. Now, what are we going to do with that when we get home?
Brush your teeth.
That's right. That's right. Except for we'll take the wrapper off first. There we go. All righty. Thanks a lot, Ben. I appreciate that. You want to take that down to your cubby? There you go. Before we go any further, I'm going to cut the fan just a second. That's all right. That doesn't matter. One more mistake. All righty. Well, hello there. Can I take this?
Would you like a glass of cold water?
Yes, I would. Oh, thank you.
Let's change your log.
Thank you. There we go. Much better. All right, let's see here. Okay, are we ready? Oh, let's see. You're Justin, right? Is that your name? That's a nice name. I like that. There you go. Justin, can I take a look at those teeth just a moment? Let's see here. Oh, yeah. Look at that set of teeth. Okay, that's quite a set of teeth you got there. You want to bite together for me? There you go. All the way on the back teeth. Bite on those back teeth back there. There you go. Okay. Does that tooth hurt right there? Does that hurt a little bit? It does? Okay. Okay, let me get a mirror here so we can look at those pretty teeth real closely, okay? This is the mirror that we use. Okay, then we have a little wiggler here that we use also so that we can see all in around the teeth real closely, okay? I'll tell you what, if you lean back just a little bit for me. Okay, open wide, open real wide. There you go, big guy. Yeah, that's good. I can see real well now. Now let me look up here also. Open real wide. Let me look over here too, okay? Okay. Now when I touch that tooth, does that hurt a little bit when I tap on it? It doesn't? It does a little bit? Okay. I'll tell you what, Michael, if you get a close-up shot. Okay. As we can see right here, we have a tooth that is discolored, probably due to a blow or an accident or a fall. And as a result, it's probably abscessed and non-vital. And you can tell by the dark appearance, so we'll want to make note about that. The left upper central incisor has abscessed, and that accounts for the discolorization. And it looks to me like also the lateral incisor also got chipped during the process too and damaged. Did you have a fall? Did you fall down? Oh my. Did that happen a long time ago or just the other day? A long time ago. Well, have you had any, does it really hurt sometimes or is it just a little?
Just a little.
Okay. Well, I'll make the recommendation that the upper left central incisor will require dental treatment. How old are you now? 4 years old. Oh my word, you're getting to be a big guy, aren't you? Okay, Justin, I've got something for you that you can take home, okay? Here's our toothpaste and our toothbrush. Let's see what kind you got. Oh, you got a green one. You got a pretty green one. That's pretty neat, huh? You like that? Now I'll tell you what I want you to do tonight and every time after dinner at night, and especially before you go to bed. I want you to brush your teeth real well for me, okay? You promise to do that? Make sure you get those upper teeth and the lower teeth and all over for me, all right? How's that sound? Pretty good? Good. Tell you what, we're going to set this right back in here and you can take it downstairs and take it home with you, okay? Thanks. Bye-bye.
Excuse me, might I make a recommendation here? Do you want to try for a little better? I got a close-up on you examining that tooth.
Uh-huh.
Do you want something to a little closer to bring it out a little bit more?
No, that's okay. That's okay. Oh, let's see. Who have we got here? Ah. And your name is Connie, right? How you doing, Connie?
Pretty good.
Good. I'm glad to hear that. Go ahead and take these. Connie, can I take a look at those pretty teeth? Let me see just a minute. Oh my gosh, those are good looking teeth. Yes, indeed. Well, let's see here. Let me take a look. You want to bite together for me? All the way together. Just keep them together. There you go. Uh-huh. Okay, the development looks normal on this. Can I take a real close look at them just a moment? I have a special mirror that we use, and you can hold on to that just a second. That's pretty neat, huh? That's how we can look and see all around in the mouth. And I'm going to borrow this back just a moment, and we're going to take a real close look, okay? Chin up just a little for me. There we go. Let's see here. Okay, let's look up here as well. Real wide. I'd like you to turn that way just a little for me. That's good. I'm going to adjust this forward. I should grab the unit and hold it. Just hold it. There we go. Open real wide now for me. Okay, open real wide. There we go. Now I can see real well. Open real wide. There you go. Open real wide. Let me look over here. Okay. Everything looks just fine. Couldn't be better. Oh, she had a little bit of crowding of the lower teeth, but say some minor crowding of anterior teeth, that's all. Otherwise, development's normal. Carol, I have something for you that you can take home. I've got a special toothbrush. And let's open it up and take a peek, okay? Let's see what we got in here. Oh, you got a green one. Looky there. That's pretty neat, isn't it? Hey, I'll tell you what. Here's what I want you to do. Every night before you go to bed, I want you to brush your teeth real well for me. You promise to do that? Good, good. That way you can keep them real clean and they'll last a long, long time, okay?
What else is in there?
There's some toothpaste in there, see? So you get some toothpaste in there too, see? See what's in there? That's pretty neat, huh?
What's that thing?
What are these? Well, these are little things, and your mom can show you how to use these because they have some instructions. But you chew on those, and you can see where you missed your toothbrushing. But Mom will show you all about that, okay? Alrighty? I'll tell you what, let's put everything right back in there for me, and I'm going to put toothpaste back in. You can put toothbrush in. There you go. Alrighty. And you can take this home with you. Bye-bye. Well, hello there. How you doing?
Fine.
Good, good. Can I see this just a moment? Let's see. And you're Stephanie, right? That's a pretty name. I like that. That's a real pretty name. Oh. Stephanie, can I take a look at those pretty teeth for just a minute? Oh my gosh, what a set of teeth. Looky there. Let's let the camera see them too, okay? There you go. Oh, those are nice teeth. Let's look up here as well. Oh, yeah, those are nice teeth. Uh-huh. I'll tell you what, let's check one other thing. You want to bite together for me? All the way together. There you go. Okay, bite right there. Okay. Okay, under development, we have a class 2 molar relationship. Possible considerations for orthodontic treatment at some future date. And we'll check the teeth a little bit closer. Stephanie, let me take one last look real good here. Just a moment. I want to tilt back a little so I can see the upper ones real well. There we go. Let's get our light so I can see. There we go. Let's see here. Open real wide. Real wide. There you go. Okay, that looks good. Looks pretty good. Okay, there's no decay or any problems of that sort. Looks real good, Stephanie. I have something for you. I have a special toothbrush. You sit right there and I'll get it. Here we go. Well, let's see what color we got. See, it might be. Oh, this one's a blue one. This is a pretty blue one. You like that one?
Yeah, where's it? Oh, there it is.
Yeah, there it is. There's the toothbrush bristles. Now I'll tell you what I want you to do. Tonight I want you, and every night after dinner, okay, and before you go to bed, I want you to brush your teeth real well. Make sure you get the back ones and the front ones and get all the teeth real well for me, okay?
I know everything.
You do?
Teeth.
Have you gone to a dentist before? You haven't, but you know a lot about teeth, and that's good. You gotta take good care of them, and you'll always have them.
You still can see them.
Mm-hmm. Thanks, Stephanie. I appreciate it. Bye-bye.
Okay, I'm running out of juice in this one battery.
Okay, you want to change real quick? That's okay.
You know what?
What?
I have a red alligator toothbrush at
You
home.
do? Okay. Might go ahead and get it running up to speed. What do they call you? What's your name?
Fuji.
You're Fuji. Ben's been
Yeah.
talking about you. You guys are buddies, aren't you?
I'm Nathaniel Fuji Sato.
Okay. Do you like to be called Nathaniel or Fuji?
Anyway.
Anyway, okay. Well, I'll tell you what. I'm going to call you Fuji, okay? Is that all right? There you go. Fuji, let me take a look at those pretty teeth here just a moment, okay? Open real wide. Look at the camera. There we go. Oh, what a nice set of teeth we got. Let me look up here also. Okay, want to lean back just a little for me, just like that. That's great. Thank you. Hey, that's real good. Yeah, ticklish, isn't it? Oh my gosh. Okay, bite together for me. All the way together, all the way in those back teeth, and just hold them together. There you go, just like that. Okay, I want you to move the teeth around a little bit and try again. Bite all the way on the back teeth. Again. Okay, the other way. Go all the way back. There you go, right there. Hold them right there. Let me see. Bite together, right like that. Just hold them there. Hold them together. Hold them together. Just like that. That's good. Okay. Okay, let me look real close now, all right? Let me see here. Ooh, that makes a funny sound, doesn't it? Okay, you want to bite together again for me? There you go. Just hold them together like that. There we go. Okay, now lean forward just a little bit. There we go. I'd say that's a pretty fine set of teeth. No problems with that. Development normal. Everything's okay. And one other thing. Yeah, molar relationship's okay. Great. Excellent. I appreciate it, Fuji. I've got something for you, okay? Here's our toothbrush, okay? And it's a green one to go with that red one you've got at home, right? Okay. There's your toothbrush, and it's a little one, okay? And it'll fit that mouth just perfectly. And I'll tell you what I want you to do. When you go home tonight, after dinner, especially before you go to bed, I want you to be sure and brush your teeth real well, okay? You promise to do that? Good boy.
What's the end game? What is it?
And there's some toothpaste in there and the whole works. There you go. And we'll put this back in for you, and you can take it downstairs and put it in your cubby.
Why does it have the holes there?
I don't know. That's a good question. Probably so you can be able to see the color of the toothbrush. Can you see in there? Bye-bye, Fuji. Everything looks okay. Everything's in good shape. You're quite welcome. It looks beautiful. Everybody smile and say hi. Okay. Jolene, okay. Okay, you're in the wide shot, and then we'll open. Children require special dental care. Early examinations along with comprehensive home care can ensure your child's oral health. I heard that, Ben. Okay, let's try it again. One more take.
Now, where is it you want me to zoom in on? I know, but when?
As I go through you want to start with a slow zoom as you come in. I'll read it off again. Children require special dental care. Early periodic examinations along with comprehensive home care can ensure your child's oral health. Early detection of dental disorders coupled with appropriate treatment can minimize the need for more extensive treatment at a later date.
Right about there, zoom in? Or is that it?
That's it.
Well, I better start zooming right away. Okay.
I might even make it shorter.
Okay.
Can you see the paper on the floor?
Yeah, I thought there was more to it, though. Okay.
We can leave the paper on the floor. I'm not worried about that.
Yeah.
Okay, let's start. Children require periodic... Oh, hold on a second. Okay, start again. Children require special dental care. Periodic examinations along with forget about it. I'll do this as a voiceover. Let's just start in on it.
Okay.
All right, everybody gather around. Come on around here so we can talk about taking care of your teeth. Okay. What we've got, can everybody see real well now?
Yeah.
Okay.
Stop where you're at.
Is everything all right, Mike? Can you see me okay? Okay, good. Okay. Now everybody's got a toothbrush now so that when we go home this evening we can brush real well. Well, I'll make sure you get one, okay? All right. Now the first thing that we need to talk about is how to brush our teeth. And this is real important because if we do a real good job and clean the teeth real well, we won't have any problems or troubles with them later, okay? All right, now here's our toothbrush, okay? Now everybody's got one of these or they will have one, okay? And I brought in a special set of teeth that we can use to go over this with, okay? Now here's what we do. Okay, all the teeth are important. Can you see the little black places here on the teeth, the little silver places?
What's that?
Well, those are fillings, okay? And sometimes you have to put in fillings so that you can take out decay. And we don't want to get tooth decay because sometimes that can make the teeth hurt, and we don't want that to happen. So what we need to do is at home, brush them and clean them real well so we don't get any of those places of tooth decay, okay? Does that sound like it's a pretty good idea?
Yeah.
Okay, now we're going to go over.
Button for?
Button?
Yeah.
Oh, well, that's not really too important, okay? I want you to sit down just a little bit for me. You want to sit down?
I can't see.
Okay, go ahead and sit back there. There you go.
I can't see.
Now everybody can see real well now. Now, what we want to do is get plenty of toothpaste on our toothbrush, okay? And you all got toothpaste too, okay? Now I want you to start somewhere in the mouth. It doesn't matter, but I want you to do it the same every time so you'll be sure and do a thorough job. Okay, you want to brush all around, get all these areas real well for me, okay? And then kind of make the toothbrush rub around on the teeth. See how I'm doing that? Okay. Then you can come back around on this side and get these teeth on this side as well, okay? That's right. Now
Why we can't do that?
well, we have to. Okay, we have to get those sides too.
We have to get behind too.
We have to get on. That's right. We have to get behind all the teeth, and the way we do that is to come over on this side, just like we're doing right here, and brushing all the way across. See how we're doing? There we go. That's pretty good.
What's this for?
Okay, well, we'll get into that in just a minute. Okay, Michael, I'd rather you get to longer shots. The close-up shots we can get later as inserts. Okay. Okay. Can you see anything at all? Okay, everybody sit down. Sit down. Sit down.
Little kid in a white shirt.
Okay, down. Everybody sit down. You can see now. Okay, we're going to go over it again. Okay, there you go. Now, everybody can see. If everybody sits down, we can see.
I can't see.
You can stand right there.
Okay.
No, see
Now, again, when we brush our teeth, it's real important that we clean all of the surfaces real well. We want to get all of those teeth clean. And we got to clean them on the back side as well as on the front side that we can see. Okay? And it's the same thing with the uppers. Again, you want to use plenty of toothpaste, okay? Here, go down there. There you go. And you want to brush real well. You want to brush all the teeth all the way around. See how we're doing that? Can everybody see that now? Here, I'll put it over here so everybody can see it.
I can see the gums.
That's right.
The gum.
Okay.
The teeth grow through gums.
That's right. They sure do.
The first time when Anthony grew his teeth, I feel his teeth. And one nail
And you saw one coming in.
And one nail got out.
Mm-hmm.
And he went, and there was.
Okay.
Don't.
Now, again, I want to go over this one more time so everybody can see, okay? Because I want to make sure okay, now we don't need to touch, okay? Just want you to watch. We can touch it later. I'll let you all see it later, okay? Okay, again, what we need to do, I'm going to go over this one more time so we all know, okay? Use plenty of toothpaste.
There's a dog
Okay.
spot too.
Okay, listen real well. Okay, you want to make sure that you clean all of the teeth real well. And we'll start in this side. Remember, we started over here. And we'll brush all the way across, just like this. And we'll reach way in on the inside like this and get them too, okay? We want to brush them all on the inside. And we want to get the upper ones on the inside too. See how we're up in there? We want to get all of those teeth brushed real well. We don't want to leave any of that white plaque that gets on your teeth. Have you all seen that? It's a little white stuff that gets on your teeth when you don't brush them.
It's kind of acid. It'll make you have cavities.
That's right. So you want to be very careful to make sure that you clean well. Okay? Again, brush all the upper ones as well. And you can come around, come around on this side and brush these real well too, okay? There we go, just like that.
Like that.
You can do that too, but it's real important to get the back teeth. If you close them like that, you have a tendency just to get the front teeth. You have to get the back teeth too, okay? Real important.
Hey, you got them something like that. This and just press them that way. Hey.
Well, that's good as long as you get those back teeth clean.
Like this. My teeth are all good.
That's good. Very good.
I'm going to ask my mommy.
Okay.
My
Now,
teeth go like that.
who wants to see these? I'll let you all see these. Okay. There you go. Now share it all around. Let everybody see it, okay? Or I'll get out of your way.
Bite yourself.
Why don't you move forward just a little bit there. Oop, oop. Oop, look out. There you go. There you go.
It's still on there.
There you go. Okay.
There's the speaker fan.
Okay, just get a couple shots like that.
Where's the speaker? Right there. What's the phone?
And follow the teeth around. Okay, that's pretty good. Let me... Okay, Mike, that's good. I'm going to need to change tapes real quick.
Give me a turn.
I'm not getting much more.